Definitely tell you, your health is your wealth. And as a result of that, for those who live in sub-Saharan Africa, there's this particular disease that many of us for some time, or let me say the world itself, have actually been fighting. That disease, for many of us, we know it in secondary school, but when you talk about the plasmodium. For many of us who are actually in the science line before we diverted into the social sciences and the rest of it, we talk about malaria every day. And this malaria of a thing has been there for long. So many interventions, so many packages to see that yes, malaria eradication is seen in this part of the world. But till this moment, I can bet you that you hardly go to a particular place within sub-Saharan Africa where people don't actually still battle with this particular disease. Especially for many of us who grew up in temperate, or let me say part of Lagos and then part of Kano, you definitely know what malaria is all about. Especially when the season is actually transiting from one end to the other. So today, we'll be focusing on issues that borders on malaria, how to understand the seasonal malaria chemo prevention. This is a major program that will give you insight about the activities of some stakeholders on how they are trying their best to see that yes, we eliminate malaria in this part of the world, most especially in the Federal Capital Territory of Abuja. And that brings us to who our guest is for today, in person of Madam Inusa Ibrahim, who is the FCT Malaria Elimination Program Coordinator. Is here in the studio and definitely will be giving us more light with respect to what they are doing and how they are doing it and why are they actually doing it to see that yes, we eradicate malaria in our society. Madam Inusa Ibrahim is the head integrated vector management HHS. Is here in the studio and definitely will be throwing more light on this particular aspect of the program. We'll go on a very short break and when we return, we'll be listening to him when he's responding to questions.
The challenge of Nigeria as a free state in 20th century Africa is the need to revive the stature of man in Africa and restore the dignity of man in the world. Nigerians believe passionately in the fundamental human rights. We regard all races of the human family as equal. Under no circumstance shall we accept the idea that the black race is inferior to any other race. I appeal to all our leaders, far and near, to forget the wounds which were inflicted in cause of our internecine altercation. The love of our country should outweigh the love of our petty selves. The enjoyment of individual freedom under the law should mean more to us than our self-centered party programs and manifestos. Common dangers and common enemies alert us on the need for common security. Come and join Abubakar with me, Sardauna, Awolowo, Akitola, Ofarebe, Okpara, Ikoku, Aminu Kano, Ibrahim Imam and Taka. Let us bind the nation's wound and let us heal the breaches of the past so that in forging our nation, there shall emerge on this continent a hate-free, fear-free, and greed-free people who shall be in the vanguard of a world task force whose assignment is not only to revive the stature of man in Africa, but to restore the dignity of man in the world. The challenge of Nigeria as a free state in 20th century Africa is the need to revive the stature of man in Africa and restore the dignity of man in the world. Nigerians believe passionately in the fundamental human rights. We regard all races of the human family as equal. Under no circumstance shall we accept the idea that the black race is inferior to any other race. I appeal to all our leaders, far and near, to forget the wounds which were inflicted in cause of our internecine altercation. The love of our country should outweigh the love of our petty selves. The enjoyment of individual freedom under the law should mean more to us than our self-centered party program.
Madam Inusa Ibrahim, the FCT Malaria Elimination Program, ED, Integrated Vector Management, HHS. Madam, good afternoon and welcome to the afternoon edition.
Okay, thank you for having me. Thank you for having me. I'm Inusa Ibrahim from FCT Malaria Elimination Program, the head of Integrated Vector Management Officer. I'm representing the Program Manager Malaria Elimination Program for the FCT. That's Hajia Zainab Ibrahim. She was engaged in several functions, and we are at the planning stage of the SMC implementation. So probably she will be with us in the next session of
subsequent program. Okay,
so
that's a very good one that you are representing one of the leaders of this particular program. And for some time, if you remember, malaria is something that just last year we had the same conversation with your team. And till this particular point in time, if I will start from that axis before I go into other matters, from that particular point, last year till this particular point, are there major improvement based on the program or the data you are getting from the field?
Yes, we have drastic changes based on the mismatched analysis carried out of recent. But you know, if we talk of malaria, people need to understand what malaria is all about and what actually causes malaria, and how are the strategies to prevent malaria. So now we focus on malaria elimination activities in FCT, and SMC is going on, that is seasonal malaria chemo prevention.
Okay.
But I will appreciate our FCT residents understand what malaria is all about.
Okay, before you go into those details, let me just quickly push this to you. Malaria has been with us for years, and yet many still confuse it with fever from cold weather, and they say you can't fight an enemy you don't understand. So let's settle this today. What really is malaria to a layman that is listening to us now?
Yes, our community's residents in FCT need to understand what malaria is all about. You know, they are layman understanding of malaria, but we need to talk malaria in the scientific aspect. So malaria is a life-threatening disease caused by a parasite of Plasmodium species transmitted to human through the bite of a infected female anapole mosquito. It is preventable and curable. So people have to be aware that we have high burden of malaria, but they are in need of awareness on how to prevent the malaria. Is curable and preventable. So it is important for us to create the awareness which is ongoing on in the entire FCT on how to prevent the malaria in the FCT. So malaria is caused by a Plasmodium parasite, and we have 5 species that causes malaria in human. 2 of these species, Plasmodium falciparum and Plasmodium vivax, pose the greatest threat. Plasmodium falciparum is the deadliest malaria parasite and the most prevalent in the African continent. Plasmodium vivax is the dominant malaria parasite in most countries outside of sub-Saharan Africa. The other malaria species which infected humans are Plasmodium malaria and ovale, and finally the ovale, but this one are mostly outside of the sub-Saharan Africa. Then the mode of transmission has to be more clear, especially in our community, to understand how the transmission and the mode of transmission. The malaria mostly spread to people through the bite of some infected female anaphor mosquito. Blood transfusion and contaminated needle may also transmit malaria. It's very important to note that. So the symptoms, mostly commonly early symptoms of malaria. Malaria has several signs and symptoms, but the common signs and symptoms are fever, headache, chill. Severe symptoms include extreme tiredness, fainting, impaired consciousness, multiple confusion, difficult in breathing, dark or blood urine, jaundice, that's yellowing of the ear and skin, abnormal bleeding, severe complications that can arise including anemia, respiratory distress, and organ failure if left untreated. Malaria infection during pregnancy can also cause a premature delivery or delivery of a baby with a low birth weight. So people need to understand we have two stages in the malaria category. We have the uncomplicated malaria, is the common malaria that we have, and we have the severe malaria if the case remain untreated. So as soon as people feel the signs and the symptoms of malaria as I have outlined, they should move to the public health facilities or private health facilities to treat the malaria. Presently, in FCT, early this year, on the 18th of March 2025, the flag-off ceremony has been done for the distribution of malaria test kit and drugs for free malaria testing and treatment in FCT Public Health Hospital, being implemented by Fancris Health Initiatives. The flagging up was done by the mandate Secretary Health Service and Environment, Dr. Adedaulapo Fasowa. So people shall have the confidence to go to the health facilities. The testing and treatment of malaria across the 6 area council in FCT is free. Can we at all age, across all age group. So people shouldn't stay with malaria at their respective residence. As soon as we feel the sign and symptoms, you should move to the nearest public health facilities for testing and treatment is free of charge.
Okay, let me quickly come in here because I can see that you actually pulling through some of the notes you have. But let me quickly ask you, from your own experience, now beyond what you have here on the text, from your own experience, how do you think malaria does actually affect our children? Because I believe you have children, and definitely you must have seen a woman that has pregnancy. How do you think malaria actually affects them?
Actually, children under 5 years of age and pregnant women are the most vulnerable age group to be infected with malaria if remain untreated and if measures has not been taken. So presently in FCT we have several strategies to prevent this age group. Specifically, we have seasonal malaria chemoprevention, that is SMC. Is for healthy children aged 3 to 59 months of age. This medicine is available. It is being distributed and administered by our trained community distributors house to house. We have done, or we have successfully implemented the first cycle in June, the second cycle in July, the third cycle in August, and in the next 48 hours today, that Wednesday, 20 September. So in the next 48 hours by Friday morning, our community drug distributors will be at your residence for free administration of the anti-malaria medicine to eligible children, and the category of the children has to be healthy to administer the drugs. That's for the age group of 3 to 59 months. So we expect our CDDs are well trained, and we have achieved a lot of progress. This program has been in the FCT since 2022, and we have successfully done in 2023, 2024, and now we are in 2025. We are presently at the 4th cycle.
Okay, you are presently at the full cycle.
Yes.
And you know, if you look at part of what is happening globally, for FCT, for instance, now we have, they say, out of the statistics are in 2024, 4 out of every 10 people are affected by malaria, and 1 in 5 children carry the parasite in their blood. For some time, I've been seeing members of your organization in some of these primary healthcare centers, and also in the local government hospital. For instance, if you go to Kubwa, the general hospital, there you see some of your men there distributing these particular drugs. How is these drugs accessible in some of this pharmacy or maybe in hospital, apart from your agent giving out the drugs?
The SMC drugs is not for sale. It is free and is available in all the FCT public health facilities. So we have specific dates for implementation for the drugs administration. So the pattern and the policy for the drugs administration is house to house. So by a trained community drug distributors, popularly known as CDDs. So and if in the institution whereby, based on your question, a situation whereby the caregiver was not able to reach to the CDD, the caregiver can quietly move to the nearest health facilities and indicate that he has the eligible children and has not been administered the medicine. That is it is 2 combination of medicine we have. We have sulfodozin, flurametamin, and amiodarone. That is SP and AQ. Sulfodozin stand for SP, then amiodarone AQ put together is known as SPAC. So it's free of charge, it's not for sale, and it's on abuse of service to find any of our SPAC in private pharmacies. And if it is found, we expect that shall be reported to the nearest health facilities or the area council or FCT public health department that SPAC has been sold or found in any pharmacy. The medicine for this seasonal malaria chemotherapy are available in all the FCT, all the public health facilities that meet the criteria for the seasonal malaria prevention intervention. It is supported by Malaria Consortium. So the medicine is free of charge, is safe, and for prevention.
When you say it is safe, and I'm not seeing it in most of our facilities, probably our health facilities like the pharmacies and the rest of pharmacy, and even some hospitals don't actually dispense such drugs. So that brings to question, because I remember I did ask this question sometime last year about the accessibility of this particular drug. Why is that it is only SMC that do, or your group, the CDD, that actually do give out this drug? Why can't we have them in our hospitals or probably in the pharmacy?
The reason is that the medicine is being supported by Malaria Consortium Philanthropy Fund. So if you are to find the medicine in a pharmacy, it's expected to be for sale and it is free. That's why it shall be found in government facilities and is available. The coverage we have for this year is 98%. The target plan to reach. The target coverage is 98%. So if you go to any community, including the urban cities, there are a series of strategies being adopted to ensure urban cities, caregivers, our community drug distributors were able to access the AMAC. You know, there are a series of difficulties we experienced in 2022 when we started the implementation. So we have adopted a series of strategies to ensure the AMAC has been covered. So we have 98% coverage for that eligible age group. So I think it's available. I have confidence that any government health facilities caregiver visited will get it, and they should make inquiry, and we have schedule of activities, and we have all the OICs in the public health facilities have been trained.
What do you mean?
Officer in charge of the primary health care. They have been trained, and if you miss the first cycle, we are now at the fourth cycle. Do you understand? So caregivers has been in the facilities making the inquiry before the time. So we have series of awareness. We have the community leaders awareness, we have the traditional rulers, we have the religious leaders. So announcement has been made in mosques and churches. Do you understand? And in a local community with the traditional rulers outlets, do you understand? To ensure that the message has reached to the caregivers. So we have high coverage, and the awareness on seasonal malaria prevention in FCT have reached the required target. So it is available at all government health facilities.
So now the SMC or the CDD, based on the term you termed it, which organization or which of the secretariat are they under?
The seasonal malaria prevention is being implemented, as I have seen earlier, by Malaria Consortium, which support in partnership, in collaboration with Federal Capital Territory Administration, that's Malaria Elimination Program, with the leadership of Federal Ministry of Health, the National Malaria Elimination Program.
Okay, let me quickly move to this. And in terms of if you had the power now to stop malaria before it even touches your child, would you use it? That's the same drugs that you are dispensing in some of these facilities. If your child is falling sick of malaria, would you still use the same drugs?
Okay, that's a very good question. As we have said earlier, there are some criteria for child eligibility. The children that are eligible for SMC, we have two categories. We have children 3 to 12 months. We have children, the blister for children 3 to 12 months, and we have the one of the higher blister, that is 12 to 59 months of age. And children that are sick are not eligible for these drugs. They should move to the nearest health facility and get tested. And now, as 2025 is concerned, testing for malaria in FCT is free, and treatment is free. So the caregiver should move to the nearest health facility for testing. If the child turn positive, they are expected to be treated at the health facilities. So in the next cycle, if they are healthy, they can then be administered the drugs.
Okay, so that's exactly so now in terms of why SMC or SPAC is so important for our children, can you just throw more light on it? How important is this particular group to our children? Because sometimes even beyond the hospital, you see them within the streets trying to mark every household. They must have actually dispensed that drugs.
Yes, the SMC is very important. It's when international intervention and being implemented in FCT. As I've indicated earlier, we begin the implementation in 2022. So the CDDs visited their household across the FCT. We have huge number of CDDs being trained, and they have been in their household early morning of all the days for intervention. We have 4 to 5 days of the intervention. So if they visited the household, they administer the medicine to their eligible children. As soon as they were able to pick up a eligible child at their residence. Do you understand? So after administering the medicine, they make a house marking. That house marking serve for several reasons. If one of the criteria for the house marking, if like the CDD team visited the house and the house has like 4 children, based on the explanation of the leaders of the house, you understand, the parent, so and they are not able to cover that 4 children, they are able to reach maybe 2 or 1 of the children, they will indicate in the house marking 2 over 4, so that to see 2 of the children, 2 among the 4 children in that residence has been administered, so they have to return back and administer the remaining number of children. These are one of the reasons. Then secondly, we have several supervisors, do you understand?
Yeah.
Supervising the implementation. We have the area council team moving around the community and the health facility, ensuring the CDDs are active, and if there are any challenges, they sort it out. Okay. We have the state team that is under the National Malaria Elimination, that is under the FCT Malaria Elimination Program, moving across the area council, supervising, and we have the national team from the Federal Ministry of Health, that's a National Malaria Elimination Program. So we have the smart survey and several reasons. So that house marking is very important. Caregivers shouldn't remove either the sticker in the urban cities. In the towns, most of the time we use the sticker, while in the rural communities we use chalk. Sometimes even in the urban city, in the rural communities, we also use the sticker. So it is served for several reasons.
Okay, so we'll go on a very short break because there are several questions that are left yet to be asked, and we'll definitely be needing more from you with respect to the response we get. And just for clarity's sake, the SMC has been there for some time now, and for many of us who do attend the primary health care and maybe let me see the basic, the general hospitals, you definitely must have come across especially for those who are within that axis of maybe pediatrics, the pregnant women now, or pediatricians. You discover that you see some of these stakeholders in that particular zone in most of our hospitals. So it is important that this information gets out to you, and he has actually given reason why you find it difficult to get these drugs in pharmacy, or maybe being dispensed actually by the hospital. So we'll go on this short break, and when we return, we'll continue with the conversation.
The welfare of millions of people for generations to come may be affected by the wisdom which we here display. If Nigerian leaders and our British partners are to prove themselves worthy of their trust, now is the time for us solemnly and truly to dedicate ourselves to seeking the greatest good of the greatest number of our people in Nigeria. Independence for Nigeria in 1960 is imperative. But independence for Nigeria as a corporate entity is not enough. The peoples of Nigeria must at the same time be guaranteed their freedom. We must ensure that in an independent Nigeria, individual citizens throughout the land enjoy liberty, human dignity, and equality under the law. There must be one Nigeria with one constitution and one law for all. Let us therefore, Mr. Chairman, sir, close our ears to the counsel of despair, which says that we cannot here at this conference agree on a constitution. If there's any doubt among us as to left as the go present,
Welcome back from that mouth break, and just before the break, we did raise pertinent question with regards to the essence of the SMC and the CDD that he did mention. And these are actually very important issues for many of us who actually live in this community where these drugs are being dispensed. And for some of us who have actually visited some of these hospitals, especially when you go close to where they go for their antenatal, I mean the pregnant women, you discover that most of these women are, most of these distributors or dispensers of these particular drugs of malaria are actually within that particular axis. And as a result of that, people do raise questions. Sometimes people just collect it and say, I will not use it. So I think that's the more reason why this enlightenment is important. So we have to get to know why they're actually doing this, and how important it is for the children to actually make use of this drug, as the age range is between 3 months, I think, to about 5. And let me come back to you, Madam Inusa Ibrahim. For some time, you know that some say the medicine is too strong for small children, and others say if the child is not sick, why then would you give them medicine? But are these things true or just stories we've heard?
Okay, now the caregivers need to understand how this implementation work. The seasonal malaria chemoprevention SMC is designed for children aged 3 to 59 months. Children below 3 months of age, they have their mother immune, so the medicine is not designed for that age group. While children older than 5 months of age or above 60 months, the medicine is not enough to prevent them from the infection. So so for that, for these two age groups, below 3 are not eligible. We have the SMC criteria, and above 5 months of age are also not eligible for the SPAC. Then secondly, we have 3 days SMC course. We have the day 1, and it's expected to be DOT, direct observed treatment. The CDD will provide a support to the caregiver on how to administer this pack. And we have I have already indicated earlier, we have 3 SPAC, the blister for that course. In day 1 is sulfodozine and amiodarone. That is one white and yellow will be administered in day 1. Then there was a questionnaire that the CDD is expected to administer with the caregiver. Will alert and will serve as a reminder to the caregiver to give day 2. Day 2 is in the absence of the CDDs. The caregivers are responsible for their child. The government and the partners always provide a support to ensure that that age group remain healthy and being protected, since they are the vulnerable age group.
Okay.
Then day 3 is also supposed to be given. This full course of treatment would serve as would help the eligible child immune to be very strong. So if they are able to administer day 1, please do not drop the blister. I know the child is already healthy, so definitely the caregiver may forget to give day 2 and day 3. So we urge the caregivers to give day 2 and day 3.
So in this particular case, earlier on you raised the issue of the traditional rulers, and what role do you think traditional rulers and probably community leaders will have to play to see that the implementation or the SMC campaign is a success?
During prior to the implementation, we have done several training on health workers. We have done training with the traditional rulers, and we have done training. We have trained the religious leaders also on how to understand the overview of the seasonal malaria chemoprevention, for them to speak on how to carry out the activities in their respective area of control. So really the traditional rulers provide support at the early stage before we begin the implementation, we went for several advocacy, and in several gathering, traditional will provide a technical support to speak and make a clarification on how the implementation is to be done. And the religious leaders also, we have done how a church mapping of recent in some of the areas in the FCT. So, and we distributed also a letters with the religious leaders to provide announcement in churches and mosques. So, apart from the radio presentation, TV appearance presentation, so the traditional rulers provide the technical support, especially where non-compliant zones are. Okay. Especially in the rural communities. Okay. So traditional rulers play a vital role.
So in this particular case that you've mentioned that traditional rulers play a vital role in the implementation of this particular program. Some people have actually said that you've been doing this for some time, and why are there been any major improvement? And if there are major improvements, or probably in some places you still discover that it is difficult to actually say that yes, you people have actually touched.
Of recent, we begin the implementation in 2022. So there was a study that was done that have been carried out. We call it on impact study. It was conducted using a routine data from the health facilities. That is between 2021, the pre-implementation period, and 2022. The effectiveness of the intervention has been demonstrated in FCT since the introduction of the SMC in FCT, and evidenced by 41% reductions in the mean incidence of confirmed malaria cases between the pre-implementation year 2021 and 2022 when the SMC was introduced. So we have 41% reduction in the incidence of malaria between that was based on the survey that was done. The 2021 is there was no SMC in FCT. In 2022 we have the SMC programs, so we have 41% reduction in the incidence of malaria within that age group. So I think it's a great achievement.
That's a very good one, and
yes, it's a good news to the FCT.
It's a very good one because we want to see that yes, there is improvement in terms of our health, especially those of our children that are just coming up, and a very good one that you guys are actually targeting between the children between the 3 months to 59 months, which will actually probably help them to live longer. In order for us to be able to have access to this particular intervention, most of our primary health centers and also the primary institution in terms of health, that's local government health facilities, you can always have access to most of the distributors of these particular drugs, most especially when you go to the unit for the antenatal unit. I think mainly you see them there trying as much as possible to educate those who should be able to take the drug. So this is how far we can go today on the program, the afternoon edition. Our discussion has been centered on encouraging listeners to avail their children to receive the SMC when CDDs visit the household or visit health centers when children are ill, and also to actually look at some of the other issues that are very, very important. You can actually seek for more explanations when you meet with one or two of the agents in some of these places. This is how far I can go today on the afternoon edition. My name is Isa. No, have a wonderful day and stay blessed.
Manifestos, common dangers and common enemies alert us on the need